Hi, everyone. This is Amber Bloom, Project Coordinator for Reach Out and Read Wisconsin. Thank you all for joining us for our second Reach Out and Read Wisconsin webinar. Before I introduce our speaker, I just want to run through some logistics. We'll be saving questions for Tessa for the last 5 minutes after she has finished her talk. I do have everyone on mute at the moment. If you think of a question or comment throughout the talk, please use the chat function at the bottom of your screen. It looks like a little conversation bubble with the words chat under it. Once it's time to take questions, you may unmute yourself by clicking the microphone or phone icon next to your name on the screen, or Alex will read out questions from the chat. Lastly, I'll be recording the webinar so that we can hopefully share today's talk with others on our website. Okay, so now on to the fun part. I'd like to introduce Tessa Michelson Schmidt as our speaker today. Tessa is a mother of 2 young children who attend a Reach Out and Read clinic for their healthcare needs. In her professional life, Tessa is a public library consultant at the Wisconsin State Library. In her role, she works with library staff around the state who serve children and families. After hearing our medical director, Dr. Navsaria, speak at a conference in 2012, she has been a great advocate and collaborator of Reach Out and Read. She is currently serving on our Reach Out and Read Wisconsin Advisory Council, and she is here today to share her unique perspective as a parent and how Reach Out and Read has impacted her family. And with that, I'd like to turn things over to Tessa.
A parent. So what do parents like to do? We like to talk about our kids. So that's what I'm going to start with. So my husband and I are proud parents to 2 small children. Our daughter is 3.5 and our son is 10 months old. This photo illustrates the role of reading in our house. The book on the left, Siesta, is a favorite. It was a favorite of my daughter's, and now we're reading it with her little brother, in part because it's a story about a big brother or big sister and a little brother. And in the book, they collect different things, and you don't know what they're going to use it for, but they're putting this all in a backpack, and it ends with the brother and the sister making a tent in their backyard with that blanket that's on the cover and having a little siesta, a little nap in the tent in their backyard. And so this is a book we read over and over again, and I was just really delighted the other day when I saw them inside our little play tent in our house, which is what's pictured on the right, and they were basically acting out Siesta, that little moon-looking object. It's a little night light that they brought in as a lantern or a flashlight, which is one of the items in the book. So I thought this was really sweet, and they don't even know I was watching them, but I snapped that picture. And I just wanted to share this because I've seen firsthand that books build better brains, and that's in part why I wanted to talk to you all today. But before I begin, I want to share a disclaimer. A bit of me in the background is that I have a background in child development. I was a classroom teacher, and I have a degree in elementary education and know a lot about how kids grow and learn. And I also have a library degree, and my area of specialty has been with children's services and children's literature. So this is something I live and breathe. And as Amber mentioned at the beginning, I am a member of the Reach Out and Read Wisconsin Advisory Council. So obviously I care a lot about this, but that said, more importantly, in talking today as a parent, in the foreground, more importantly, is that I have never parented before, right? So that's really something that is critical to think about when I'm sharing my perspectives as a Reach Out and Read clinic user. And the other fact is that every child is unique. So even if I know something about parenting, and certainly I'm sure many of you have seen the family comes in with one child, and then if they have a sibling, it's a completely different story of when they started teething, or a condition with their skin, or milestones. Every child looks different, and so that's something that's huge on my radar when I'm going in, and also kind of forefront in thinking about my parenting experiences, that theory and practice are very different. You might know something or know that that's your idea, that the ideal or how things should work, but in practice, things look very different. So basically, as I said, well, you can see that we have raised 2 readers so far. That doesn't mean that the Reach Out and Read experience is lost on us during our well child visits. So I'm going to share a few things that are my takeaways from my visits to the clinics for our well child exams. So first of 3 takeaways, high five. Positive reinforcement goes a long way. And what I mean by that is that going to these well child visits, you know, any feedback we get is just a huge bolster to the work of being a parent. The appointment, of course, is about my child, but it's really about me, us, and how we are helping our little one grow. And so we fill out and we discuss those ASQs in each visit, and we talk about the milestones. But while my baby might be crawling and babbling, it also means that we've made it just that much further along since our last appointment. You know, they say that cliche that the days are long and the years are fast when you're parenting, and that really rings true. That's why getting a book at the well child visit is a gift for the child and the parent. It's really that marker of you're doing it, you've made it, keep it up. So just thinking about families, and my own family included, we might come to the appointment late or with a wet diaper or a scribbled on form. So that's just the realities of parenting, and it really means a lot when you say that you see us, that you get it, and give us any of that positive feedback on how we're raising our children. Well, again, the appointment is about their medical experience. It really is about our role in their new young life and helping foster that as much as possible. And then my other takeaway specifically for the Reach Out and Read experience is that diagnostic component really does matter. And you know, it's been emphasized time and again that Reach Out and Read is not a book giveaway, and I really take that to heart. It's so empowering to see that such a simple thing, holding my child and looking at a book together, tells you, the practitioners, so much about our child's development. When you say things like, oh, he's really chewing on these pages, or, oh, it's great that she's pointing at things in the picture and asking questions, you are stoking the fires in our engines. And as parents, we need all the support we can get. And I know there are so many things that happen in a relatively short amount of time during one of those well child visits. The height, the weight, the eyes, the ears, the ASQ, the questions. So doing that diagnostic exam with the book might seem like one more thing, but it's not. We don't weigh our babies at home or listen to their hearts with the stethoscope, but we do read to them. So giving us a book and helping us see how our babies are doing is really empowering. And this leads to my 3rd point. Brain development is a mystery, so please illuminate us. Anything you share about why my baby or toddler is doing what they are doing is incredibly valuable. So for example, if my baby is batting at the pages of the book and you tell me that he is exhibiting awareness of cause and effect, that's really helpful. I might know this, but I might recognize it or see it in a different way after you say it, because it's so good to hear from an expert, someone who's not another parent, well, necessarily, just not one of my parenting friends or a member of my own family, but hearing it from you, someone at the clinic. And this might help me find more tolerance when later that day my child is pounding his sippy cup on the high chair, when I can think, oh, he really likes that cause and effect. He's seeing what it's just like when he was hitting the pages of the book. So that really matters because I have that additional perspective on why he's doing that. And like I said at the beginning, there's a huge difference between theory and practice. So you might know that ages 2 and 3 are all about asserting independence, but to hear why and understand how it's an important part of growth and development is really reassuring. So again, that often is folded, the brain development pieces and insights is often folded into that diagnostic exam. And so that's why I just want to reaffirm that that's a really important thing you're doing. It's a conversation piece and it's helping build that reassurance, and it's all folded together in such a brilliant way. So I'm going to just switch gears and put on my librarian hat. As mentioned, I work as a librarian and have a lot of experience talking with kids and families and library folks about books. But everything I shared earlier was really about my experience as a parent with only my parenting hat on. But I feel like the part of the reason I'm talking to you today is that I'm a member of the Reach Out and Read Advisory Council. And that's because of the work I do with our libraries around the state. So I can't help but think about Reach Out and Read and some things to share with you from that library perspective. So here are 3 additional takeaways. So creating that literacy-rich clinic goes a long way. I've been to a few different Reach Out and Read clinics, and I love when I see books in the lobby waiting room and in the appointment rooms. It really reinforces the idea that reading is a great thing to do when you have a few minutes to wait together. It also reinforces the idea that reading is, quote, doctor approved, quote, because children will associate books with the clinic experience. And they really do. Well, not my little one, my 3.5-year-old knows which books she got from her visits, and they have a very distinct role to her because she knows that's where they came from. And there's even a book she reads that refers to getting a book at the doctor's office, and she knows, yep, that happens to me too. I get a book, and it's something she looks forward to. So anything that you can do to help reinforce the idea that books build better brains is valuable. So this might be as simple as making books available in the lobby, or putting up a sign explaining that you're a Reach Out and Read clinic and what that means. It might mean something like updating the posters in your clinic to feature characters from books instead of generic kid-friendly artwork. There are lots of ways to make this happen, even if you have restrictions from clinic administration. So those are just a few ideas. Another takeaway is that books reflecting diversity makes a difference. I'm guessing you've heard this before, and I hope you hear it again. Children need to see themselves and others in the books they read. For example, the book pictured here, More, 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 Said the Baby, is a classic and a favorite at our house. More is a common first word from small children, and this book repeats that phrase through parallel stories of 3 different children. In this book, you first hear from Little Guy, which is about a white boy and his white daddy. The next story is about Little Pumpkin, who's an African-American girl who lives with her white grandma. And last is Little Bird, an Asian American girl and her mama. Now, this book was a bit of a rarity when it came out, and thankfully the publishing industry is slowly changing, so books like this are more common. I really urge you to seek out these books and help validate and empower the young children served by your clinic, especially when Reach Out and Read books might be the only books that are part of your patient's home libraries. Now, you probably know this, but research shows that children can identify race and ethnicity as young as age 3. And books can be a really natural way to facilitate conversations and increase exposure. So for example, in this book, Little Bird and my daughter, every time we get to this part and little Bird is going to bed, she sleeps on a couch. It's a couch that folds down into a bed, and that's part of the scene depicted as her mom arranging the cushions and putting Little Bird to bed. And she talks to me about this, of what's this and why is it not a bed like her bed? And we talk about how every family is different. And, you know, I, as an adult, understand that the author illustrator is trying to depict families in different situations. And this, again, is just a conversation point for us in a way that comes up naturally and is giving my daughter some real understanding of how different people live in the world. So my last takeaway is that it takes a village to raise a child. And you can model this by working with your village library. So I wouldn't be doing my job if I didn't urge you to connect with your local public library. And this is because you don't want to isolate reading to just the clinic visit. You want to give your patients a prescription to read through their local public library. But you can also benefit from connecting with your local library at the clinic level. This map shows the 400 plus locations in Wisconsin for public libraries. And there are many ways to partner and support each other's literacy efforts. For example, library staff might be able to come and help you with ways to make your clinic more literacy rich, or simply offer bookmarks or recommended reading lists for families with different age groups of books. Your local library might also be able to help with fundraising efforts or sharing communications about early childhood literacy events. Possibilities really are endless. And obviously, I'm a bit biased because I really support this program, but it's just something I've really appreciated more since becoming a parent, and just seeing the ways that it really can be this core foundation for empowering families and building that habit of reading and really improving the lives of our young people who are going to grow up and take care of this world we live in. So I appreciate all the efforts that you do, whether you are a nurse and checking in and doing that height and weight, or if you are a physician who's doing some of the diagnostic components. You all play a role in validating reading and empowering families, and I appreciate your efforts on that end. So hopefully we have a question or two, and I'll turn it over to Alex, who's going to walk us through those.
Hi. All right. Great. Thanks, Tessa, for giving us your perspective. That was really informative and very interesting to hear. If you have a question, you can unmute yourself and say it out loud, or if you're more comfortable using the chat function, that is again at the bottom of your screen. One of the questions we had, and it's something that you alluded to during your presentation, was you've obviously have two readers on your hand, but the reach out and read messaging is still very important to you and your family. Why do you think it's important for all parents, one, to receive this messaging, and then also, like, what do you think is one key component of the reach out read messaging that all parents should hear?
Well, thanks, Alex. That's a really good question. I would say, and again, this is something I knew, but once you start living it and talking about it and thinking about it and hearing from different folks, you just resonates on a deeper level. And that's the basic fact that early childhood brain development is a critical window of development, and reading is one of the easiest and cheapest habits to foster good growth. So I would just say that everyone, regardless of their income level, they want to hear that their child is smart, and they, as parents and caregivers, have the capability to help that child get smarter. So that's just, I think, fundamental. And so reinforcing that by saying, well, you can do this, and I'll show you how, and here's how, here's why and how reading makes a difference, is just critical, because that early childhood window, it has so many, it affects things for so long in their life, and not in a scary way when you think about something as simple as reading and how that really can build a better brain. So there are lots of ways to say it, and I think just hearing it again and again is really important, because every child wants to feel that they can do something, and you're actually physically giving them a tool to help do that, and showing them ways that they can keep doing that. It's just really powerful.
Yeah, that is great. Thank you for your perspective on that. At this time, I don't think we have any questions, and we're just about to our time limit. So if anyone has any other questions, please feel free to contact Tessa with her email below, or you can always contact either Amber, myself, or Karen if you have more reach out read specific questions. But thank you to everyone for tuning in today. We really appreciate it. And thanks, Tessa, for presenting to our group.
You're welcome. Thanks again, everyone.
All right. Thanks, everyone. Have a good day. Bye.